Hello friends, today I'll be sharing with you what is the latest treatment for hyperpigmentation or melasma. What are the latest treatment modalities that are available now? You know, hyperpigmentation of face or melasma is a very difficult condition to treat. The problem is with this condition is that even if we use the best of medicines, the most expensive medicines, it's not that we don't get results, the results do come, but it is very difficult to maintain these results. So often after some time the results disappear and again the pigmentation comes back and the patient feels so disappointed and so upset that I spent so much of money getting this thing treated and again that problem is back. But this is a very practical problem that we face, and unfortunately I must tell you, with whatever medicines we are using, melasma and hyperpigmentation is not totally curable. We can only decrease it, we can only make it little less, but if you're not careful, it can very easily come back and make you feel very disappointed with the whole thing. Now, having said that, let me tell you what are the latest treatment modalities that we have to improve your skin quality and texture and decrease the hyperpigmentation. So friend, the first line of treatment for the hyperpigmentation and melasma is the use of some ointments, what we call topicals, to be used. There are various chemicals that are used like hydroquinones are the one which are the most standard and most commonly used medicines. Then the triple combinations are there, and this triple combination and hydroquinones have to be used very carefully, only under the experience of a doctor who knows, because they can have side effects. Having said that, these are very effective medicines, and in 2 to 3 weeks or 1 month you can expect very good results with them. But please do not use them without a supervision of doctor, because if you use them for longer time, they can have very severe side effects also. Let a doctor monitor these if you're using them. So hydroquinone and triple drug combination are the first line of treatment in the topical that we often recommend to the patient, only under the supervision of a doctor, not to be taken by chemist or yourself. This is the first thing which we tell. Then there are some safer alternatives which are not as effective, but they're good for maintenance, like kojic acid, like arbutin, azelaic acid. Now these are other things that we can always add on to the treatment to improve our results. Vitamin A derivatives like retinoic acid are very effective in treatment of melasma and hyperpigmentation, and often they are added to the regime and various parts, maybe initially or later on, to improve the results. So retinoic acid is very important again as a topical for improving the result of the decreasing the pigmentation. Now these are the topical ointments, and many of them, the market is flooded with them. The thing is to get the best with the least side effects, and for that you have to make right choice, and I think the doctor is the right person to make right choice for you. That is the first thing I would say. Now, one thing very important with whatever treatment that you're taking for hyperpigmentation, you must understand that all these medicines in some way or other are removing your top layer of the skin, and when you're removing the top layer of the skin, what is going to happen is your skin become very sensitive to sunlight. So it is very important to use sunscreen at least thrice in a day along with whatever treatment that you are taking. A good quality sunscreen with SPF of more than 30, water resistant, broad range, both physical and chemical, covering both UVB and UVA, at least 3 times in a day should be used. This is something which is now very important for the treatment of hyperpigmentation. So sunscreen is a very important thing that we should be adding along with all other things. Another thing that's very effective for hyperpigmentation, topical in application, is the use of some antioxidants like vitamin C, ferulic acid, and other antioxidants that are used as a topical, like vitamin E, to be topically applied, that can further improve our results. Then topically use of niacinamide and hyaluronic acid is other things that are often ordered to add-ons to improve our result of skin texture, skin moisture, and also to decrease the inflammation in the skin. These are topicals that are being used from a long time. One very effective treatment that we find for the hyperpigmentation, the use of chemical peels. Now chemical peels like glycolic acid peels, like TCA peel, salicylic peel, or combination of peels are very, very effective, especially if they are taken regularly after every week or after every 2 weeks for about 8 to 10 times to improve your hyperpigmentation. The chemical peels are not very effective if you depend on 1 or 2 times, but if you take them regularly, periodically, every once in 2 weeks or 3 weeks, then they are really very effective. So periodic use of chemical peel is a very, very good way of improving your melasma and hyperpigmentation. So this is something which we normally recommend to be used along with other things to improve your results. Now, beside the chemical peels, there are new things that are being tried, like PRP is one, Dermapen or Derma Roller, especially along with some growth factors, with some serums and with some lotions that can help in hyperpigmentation. And we are also using mesotherapy. Mesotherapy means especially giving injections in small doses just below the skin. So there are some mesotherapy products like we use glutathione, vitamin C, tranexamic acid in mesotherapy, and those mesotherapy is also being used a lot in the management of hyperpigmentation. We come to the lasers, and I will say lasers are not really that effective in the management of hyperpigmentation. Especially we cannot depend alone on them. Lasers should come quite late in the treatment, not as a first line of treatment for hyperpigmentation. For the laser, Q-switch lasers are the most important that are being used. And when we use Q-switch laser for hyperpigmentation, we in a special mode called skin toning, where basically we are using a Q-switch laser in a very, very low energy, at very low power, less than 1 joules, and at a very big spot size. Idea is to do not cause more injury. Any injury caused to the skin by any way, either by heat or by chemical method or by lasers, itself can cause increased pigmentation. That is called PIH, post-inflammatory hyperpigmentation. So that's very important. Then after lasers, the role of some medicines orally is becoming very important. Like tranexamic acid is becoming very popular now and very useful to prevent the melasma, especially taken orally. Along with that, we are also using some medications like Xantox or glycyrrhizin, which are also very effective in decreasing the pigmentation. Then there's some like oral sunscreens like polypodium leucotomos is like a herb which is very, very useful and help you in case your skin is more sensitive to the sun. So polypodium leucotomos can also being used. So these are few things that are being used orally. Some people are trying sublingual and oral glutathione also to decrease the formation of hyperpigmentation and for melasma, but still there are a lot of controversies regarding that. So friend, these are the various modalities and treatments we are having for hyperpigmentation, and hoping to see you sometime in future with these modalities to give you the best results. Thank you. I am from Dr. Sandeep from Carewell Medical Center.